Have you heard about TSS? That's toxic shock syndrome. In this video, I'm going to tell you about toxic shock syndrome and its treatment briefly. Toxic shock syndrome, it's an acute life-threatening illness caused by gram-positive bacteria, especially Staphylococcus aureus and Streptococcus pyogenes. Clinical manifestations. If you see the characteristics clinical manifestations, there is high fever, which is greater or equal to 38.9 degree, and hypotension, diffuse rash like sunburn like rash, and desquamation like skin peeling. If you see the treatment of toxic shock syndrome, in toxic shock syndrome there is a role of clindamycin. Clindamycin is an antibiotic which suppresses the toxic, which is actually the cause of toxic shock syndrome, that is TSST1, that's toxic shock syndrome toxin first. Clindamycin, it binds to 50S ribosomal subunit and thereby decreases the production of toxic shock syndrome toxin first. If there is already toxins present in the blood and this toxic shock syndrome it's a kind of a severe syndrome, then along with clindamycin you can give IVIG, that's intravenous immunoglobulin. Next, for hypotension, for hypotension correction, you have to look the BP. If the BP is very low, then you have to give IV fluids and you have to give also vasopressors like noradrenaline. So what's the overall treatment here? First, you have to give clindamycin. Then next, if the toxic shock syndrome is severe, then you can give intravenous immunoglobulins, which can neutralize the toxins which are already present in the blood. And if there is hypotension, severe hypotension, then you can give fluids and vasopressors like noradrenaline in order to manage this toxic shock syndrome. Thank you.